War, disaster and poverty raze towns, destroy infrastructure and leave communities with little or no health care. Through the ages, the nature of war has changed, and with it the injuries sustained. Explosive weapons in modern war inflict terrible injuries, mostly on the civilian population. Natural disasters such as earthquakes, tsunamis and storms cause injuries which require time-critical surgical interventions in austere care settings. But even at the best of times, untreated chronic disease and neglect can breed festering wounds. What makes matters worse? We are losing the fight against antibiotic-resistant bacteria, particularly in compromised healthcare settings where there are few treatment alternatives. In war, disaster and poverty, many communities lack access even to the most basic medical care. Poor road and transport infrastructure disrupt medical supply chains and leave communities isolated. For patients, this unholy alliance of injury, disease, inadequate healthcare and infection means living for years with chronic wounds. But at what cost? Patients don't only lose their limbs, they also lose the ability to work and care for their families. At MedMagLabs, we believe that the solution to effective and affordable wound care in compromised healthcare settings is maggot therapy. It is the therapeutic use of fly larvae, commonly referred to as maggots. When applied to the wound, medicinal maggots remove dead tissue, fight infection, and stimulate wound healing. Because of these multiple benefits, maggot therapy can replace conventional wound treatment approaches, especially where anesthesia, effective antibiotics, and trained doctors are in short supply. Medicinal maggots are highly perishable. They need to be kept between 6 and 25 degrees Celsius and must reach the patient within 24 to 48 hours from dispatch. For wound care in isolated communities, where fast distribution is not possible, we have developed supply chain solutions that enable decentralized medicinal maggot production at the point of care. The first is a user manual that empowers isolated communities to be in charge and produce their own medicinal maggots. These production procedures do not require sophisticated laboratory equipment, but use universally available low-cost objects such as cutlery, plastic containers, and glass jars. Concise illustrations make sure that key information is accessible to visual learners. Every step of the production process is explained in non-technical terms and in multiple languages. We have collaborated with citizen scientists to develop and test production methods that can be performed by untrained laypersons who have never worked in a laboratory. The user manual explains the entire medicinal maggot production process, from the collection and care of flies to the disinfection, incubation and packaging of germ-free maggots fit for clinical use. Given that smartphones are now widely accessible to people across the low and middle income world, the production manual will be offered via a phone-friendly website, printer-friendly fact sheets and an app for offline use. Some compromised healthcare settings during conflict or disaster may demand greater volumes of medicinal maggots to cope with the wound burden. For these care settings, we have collaborated with Royal Wolf to prototype a mobile shipping container laboratory, the Sea Lab. The 20-foot-long unit is divided into two parts, the insectary and the laboratory, with separate entrances. The insectary houses 16 fly cages, holding up to 1,000 flies each. The temperature is maintained at a comfortable 23 to 27 degrees Celsius, and flies receive 14 hours of light each day. The insectary layout is compact and yet provides enough room for the daily maintenance of fly colonies. The laboratory is larger than the insectary. 2 technicians may share this space. It is equipped with a laminar flow cabinet to provide a sterile work environment for the production of safe medicinal maggots. The laboratory is also furnished with an incubator for routine quality testing and other equipment for the production of safe medicinal maggots. The lessons learned from this prototype are now translated into a commercially viable mobile laboratory that is fit for purpose and can support the activities of clients such as the United Nations, aid organisations, emergency agencies and military medical corps. At MedMagLabs, we have also developed a treatment manual and treatment videos so that physicians and lay carers in compromised healthcare settings have the knowledge and skills to administer maggot therapy. Unlike surgical and other advanced forms of debridement, maggot therapy can be administered quite safely by nurses and even lay carers. For patients and family carers from a variety of socioeconomic and language backgrounds, we have used non-verbal visual storytelling to normalise the treatment. Illustrations have also been employed to help clinicians and family carers to understand what wounds are suitable for maggot therapy and where treatment is contraindicated or may proceed with caution. If clinicians decide to use maggot therapy, they can consult MedMagLabs treatment decision-making tools that explain how to choose the right dressing and how to apply medicinal maggots. Finally, treatment videos demonstrate how to administer maggot therapy both in high-resource healthcare settings and, more importantly, in care settings where advanced dressing materials are not available. There is hope for people with chronic wounds, no matter who they are and where they live. Maggot therapy not only saves limbs and lives, fast recovery from injury restores livelihoods and the well-being of the entire community.